Good morning. This is Debbie Hart, President and CEO of BioNJ. Thank you so much for joining us today for our webinar on BioNJ's members-only health plan. As you probably know, managing and controlling employee health benefit plans is both complex and expensive. And in fact, we've heard from many of our members at BioNJ that they've been looking for an effective solution to deal with rising healthcare costs over many years. For this reason, we are very excited to be able to provide high-quality, affordable group health benefits to our member companies, their employees, and their families. We are delighted to partner with Connor, Strong & Buccalew, an affiliated physicians and employers master trust. And we're excited to be one of the first bio associations in the country to be able to deliver such a solution. So the goal of today's webinar is to provide you with a detailed overview of the plan, as well as to highlight how it differs from other options in the marketplace. Little housekeeping before we get started. This is a listen-only webinar. We encourage you to submit questions via the dialog box on your computer screen. We have a very good-sized group this morning on the line, and we'll try to get to as many of your questions as possible within the hour. We'll do that at the end of the presentations. If we don't get to your question, we will follow up with you after the webinar. So tomorrow, there will be a recording of the webinar on the BioNJ website, bionj.org. You can look for that there. So now let's get started. It is my great pleasure to introduce our presenters. Joe DiBella, Managing Director and Executive Vice President of Connor, Strong & Buccalew, and Bridget Gillis, Chief Sales and Marketing Officer of Concord Management Resources, are joining us this morning. And to get us started, Joe is going to kick off, and he and Bridget are going to tag team and go back and forth. So thanks both for being here. We appreciate it. Look forward to hearing from you. Thanks for having us.
Thank you. Appreciate the introduction and your kind comments, Debbie. As was mentioned, I'm Joe DiBella with Connor, Strong & Buccalew, and I'm joined by Bridget Gillis, who is with Concord Management. And as you can see, what we want to really get to kick things off, in many cases, this acronym of let's get to the brass tacks is very appropriate. This morning's discussion is going to focus on a very contemporary and leading edge solution that is being made available to BioNJ companies. Frankly, to give Deb and her team here credit, it is, we believe, the only such program of its kind of all of the bio associations in the nation. So this is a leading edge, very contemporary solution that is going to make available to BioNJ member companies a benefit program that covers medical, pharmacy, and dental coverages that, in essence, is going to create, through the economies of scale, the ability for BioNJ companies to have far more stability in their health benefit costs on a year-over-year basis. It's going to substantially increase the number of options that BioNJ companies will have to make available to their employees and participants, and to be able to do so in a cost-effective way that we believe will outpace and perform better than the markets that many of you are buying your health insurance from today. We know that for particularly the bio and the life sciences industry, that attracting and retaining employees is your number one HR priority. And in order to do that, you have to have a robust and yet affordable health benefit plan. The vision behind what BioNJ has done is to put in front of each of you the ability to meet those objectives, and not just on a short-term basis, but something that can be realized on a multi-year basis. And so the brass tacks is that we're going to be talking about a benefit program available to BioNJ companies that pools together many like-minded companies of your size and scale that will, in essence, allow middle-sized companies to be able to get the economies of scale and the leverage that generally is reserved only for very large companies. And so this is really a unique benefit program that we think, quite frankly, from an association perspective, is the first of its kind for a bio group. So this program is referred to as what's called AMIWA. That's an awfully long acronym, but important that we explain what that is. And so, Bridget, would you speak to the MIWA, what it is, and sort of demystify this as we go through the material?
Sure. So MIWA, it is a multiple employer welfare association, which is
in all kind of terms, the vehicle that allows these small to mid-sized employers to join together. So it is a trust. And as Debbie mentioned earlier, the partnership is with the affiliated physicians and employers master trust. And that really is the overarching entity for all of the associations that have joined together. It will be marketed as members' health plans, so you may see both affiliated physicians master trust as well as members' health plan, but it is one and the same. And what AMEWA allows you to do, it is a self-insured association health plan that allows, to Joe's point, small to mid-sized employers to come into a single platform, which is member-owned, to offer healthcare benefits to member employers and their employees. And we're going to continue to talk about the increase in scale. And the scalability allows these small employers truly to benefit from being a large employer. So the overall risk is pulled together, both in their claims experience as well as their healthcare fees or premiums. So it is looked at as one total health plan versus each individual group by itself.
So to piggyback on what we just went through, what Bridget described, think of it this way. Today, many of your companies buy insurance from a health plan, a health insurance company. What AMEWA is a trust that is the vehicle that allows multiple companies to band together to better purchase their health insurance. Is that a fair description?
Absolutely, yes.
Wonderful. So do you want to talk maybe, Bridget, a little bit about the members' health plan and some of the other associations that participate in this program in addition to BioNJ?
Yep. So members' health plan, it is an existing self-insured MEWA. We are registered with the New Jersey Department of Banking and Insurance, so that means that we follow the small employer health benefits plans. But we're also regulated, it's an ERISA plan, so we are regulated by the Department of Labor and Workforce Development. And what that does is it gives protections to our employers, to our employees that are enrolled, to ensure that there are regulations, that there are things in place to protect all of our membership. The Members Health Plan has been operational in New Jersey since 2002. We were actually one of the first regulated MEWAs. We were proactive in having legislation passed to have a MEWA regulated to ensure that our employers and our members were protected. And it really has provided us the opportunity to offer a high quality, affordable health plan with prescription benefits to our members through our sponsoring organizations and associations. So in addition to BioNJ, there's various other entities that have sponsored the health plan. To name a few, the Employers Association of New Jersey, the Medical Society of New Jersey, Central State Medical Center, as well as hospitals, IPAs, organizations that wanted to do something in like for their employers by offering them an alternative in the marketplace.
So a takeaway on this one here, as you can see in this members health plan, BioNJ is one of the associations that participates, along with, as you can see on the bottom of your screen, other associations or entities that have collectively banded and pulled themselves together to create this large health plan, helping us deliver the economies of scale. So let's talk a little bit about the value of this program. How is it different, and what will it do by way of differentiation for BioNJ companies? Well, the Member Health Plan of New Jersey, it's really intended for small and middle-sized businesses. An employer that has, say, many thousands of employees has the ability to design and administer a health and pharmacy plan on their own. They can leverage their own economies of scale. This platform is specific for small and mid-sized employers that, as a result, now BioNJ, being inside the Member Health Plan, rather than a company buying benefits on their own for their 50 or 100 people, they get the economies of scale of 35,000 total lives that compromise and that make up, if you will, what the total health plan enrollment is in this program. A couple of real important features. This is a program that is, in essence, owned and run by all the member companies that participate in it. There is not a, quote, separate insurance carrier that's making profits. The intent of this plan is to charge premiums that adequately cover the program's costs and their administrative fees. That's the purpose of the program. Now, taking nothing away from a for-profit insurance company, they do a good job and they serve a purpose, but this is different in that this benefit plan is intended to solely and exclusively work for the benefit of the member companies and their employees. And to the extent that profits are generated, they get poured back into the plan, back into the premiums, back into the operation of the program, which is very, very important. So as you can see, in the event that there are surpluses and so forth, all of that is used exclusively to help the future operation of the plan versus potentially a dividend to a public company. The other important piece, and we'll probably mention this a few times, is that with BioNJ participating in this program, Deb Hart sits on the board of this program. And so the BioNJ member companies have unparalleled representation with the actual plan itself in advocating for what's best for BioNJ member companies and having a seat at the table when it comes to dealing with insurance issues. That does not happen when one of your companies deals with an insurance carrier and you're trying on your own to negotiate or get involved in many of the day-to-day details. That is a tremendous value-added advantage, very unique to BioNJ. Employers get the benefit of being self-insured, but don't have to worry about any additional or unreasonable administration. The program works and feels just like you're buying coverage today from many of the insurers you deal with. You get your premium, you pay those premiums, and all of the other details work very similar to how plans are run today. However, what is different? By taking your one-off businesses and having them in this pool that is made up of 35,000 lives, we are absolutely benefiting from more predictable renewals. We know and we have heard from many of the BioNJ small and mid-sized companies that the unpredictability of the year-over-year increase, one year it's a 5% increase, then the next year it's a 20% increase, then it's a 2% increase, then it's a 30% increase. It is virtually impossible for management to operate what is probably their second largest expense after payroll when they have no idea what's coming down the pike the following year. Because this is a much larger pool, it is far more predictable. So these big shocks that happen on a year-over-year basis are largely eliminated because of the predictability of the larger pool. We also are able to get better fixed and administrative costs because of the large pool. As I mentioned earlier, taking nothing away from a for-profit insurance carrier, but in this program, the only entities we're worried about are the BioNJ member entities. There is no desire to create carrier profit margin. Any amounts that are collected in excess of what the program actually costs gets put back into the program. Because the program is self-insured, it does have some advantages. There's no premium taxes, and there's a little bit more flexibility from a design point of view. And again, the risk of being in this kind of program is far less than what many of you deal today with the unpredictability in the small and middle market because of the sheer buying power and the predictability that comes with being a part of a much larger entity. So the Members Health Plan of New Jersey, let's share a little bit of the numbers, and Bridget and I will share and sort of tag team through this. Here's the important point. This is a very large, stable, predictable platform of like-minded companies, like BioNJ companies, that have banded together because they're fed up with the normal day-to-day insurance market and are looking to have more long-term stability because of the power of some of these numbers, which we think is exceptional. So Bridget, do you want to hit maybe some of the highlights and important themes here?
Sure. So we, as Joe mentioned, we currently have 35,000 plus members and growing. That is critical in the law of large numbers. The bigger you are, the better, the more stable the health plan is. It's made up of over 3,600 employers, and those employers range from the size of 2 to 300. It really is not a plan that is designated for any particular size. It is designed for anyone that is looking for an alternative, that is looking for a long-term solution. And again, healthcare needs to be a long-term solution, and you will see that with our average employer retention rate of 87%. That means that when our employers come into this health plan, they stay. What that means in return is that our average renewal increases year over year have been affordable. And again, to go back to Joe's point about nonprofit, those increases are intended to pay for the claim. So if the plan collects $1, we want to make sure that we spend as close to that dollar on claims and expenses to make sure that you are paying what you need to pay to have this health plan. There is not a build-in to make sure that anyone is making money, and our increases are accounted to make sure that we have enough to pay those claims and expenses. Part of this health plan is, as much as it is a member-owned and you have increases, there's an opportunity for a refund as well, and the plan has given refunds in 3 of the 17 years. Now you ask, why haven't we given refunds more over the past years? If we give refunds, it means we collected too much money. Again, we want to make sure that we collect enough to pay claims, enough to pay expenses, and we want it to benefit the members. So we are as close to that line as we need to be, so it doesn't hurt or benefit anyone on one side or the other. The other big point here is, and I'll go back to being regulated by the New Jersey Department of Banking and Insurance as well as the Department of Labor. This plan has gone through required audits, right, between both the Department of Insurance and Department of Labor, with the intention that it is protecting the consumer. And all of these audits have been successful audits. We have not had any problems with fines or findings that have been a problem to the health plan. And again, this means that this is managed and maintained in a responsible way, that it truly is a benefit to our membership companies. One of the other things that we have been able to do and why we are successful in the market is we are mirroring the market benefits and the networks that are out there. So we'll talk a little bit about the benefits, the back office, and what and how we do that, so there is a confidence level that this is a valuable plan to BioNJ employers.
So let's dig into some of these very unique advantages that we believe are important to highlight. And we've covered on some of them, but let's give you the detail. So from a cost point of view, groups that are already in the member's health plan, the most recent renewal for those groups was 0%. Now, that's not something that is able to be promised or sustained on a year-over-year basis. But for certain companies that are already in the member health program, their most recent renewal being 0 is a tremendous, tremendous achievement. In fact, the average increase for companies this year has been less than 6%. When we contrast that to the private marketplace, when your HR lead or whomever handles benefits, your broker, goes to the private marketplace, we are seeing increases twice that amount and more. So this really speaks to factual and empirical evidence around the stability and the strength of this program, which we think is very important. As I mentioned earlier, what's unique for BioNJ companies is that your president is on the board. So obviously, Deb Hart having a seat on the board and being a voice when it comes to these healthcare issues is going to be extremely important in representing those issues important to BioNJ. That does not exist when you're working with or negotiating with a direct insurance company. So we believe this representation will be very important and very impactful. Another important feature to note is that many, if not all of you, work with an insurance broker today. They're likely your trusted advisor. They go to the market. They help with design. They help with budgeting. You can keep the broker that you work with. There will be no interruption. This simply would be a program that your broker would be able to bring to you and work with you in the way they do today. They will continue to earn commissions, and they will continue to be able to be your trusted partner. So that relationship, which we know is very important, does not in any way get disrupted or turned off. There is also a very high level of service to your employees. We haven't mentioned it yet, but Aetna is the administrator on the claims and the network and the service side for this program. And one of the arrangements that exists with the member health plan is a separate team that only works on the member companies that are in the member's health plan, which will include BioNJ members. So when they call, they get a dedicated team of Aetna representatives that know about this program, its unique features, and in addition, it is more of a concierge type program. The Aetna service model will include the traditional assistance with claims and benefit questions, but it also includes one-on-one health coaching. It includes outreach when a participant is dealing with a chronic or a catastrophic medical condition in a way that does not exist in the small and middle group markets. In addition, the administrative arrangement to be in this program, we think, is very, very easy and is very, very favorable. BioNJ companies will have a member portal available so that all of the information with respect to a participant and them being enrolled can be done online in a very efficient way versus perhaps your administrator today or your HR folks today having to go to multiple sites or perhaps even send in paper. We think that the administration behind the delivery of the program will be very, very exceptional. And as I mentioned earlier, Aetna is the carrier or the network that powers the member's health plan. Here's why that's important. The Aetna network is among the largest in the country. So if you have a son or daughter away at college, they can be in this program and use network doctors. You're traveling out of town on business, you have this national network. And inside New Jersey, their network is perhaps the most premier of those that are available, and your members walk around with an Aetna card in their wallet, perhaps the most recognized and respected name in healthcare. So a little bit further on some of the details with respect to the value of this Aetna platform. We talked about this a little bit, this very significant member engagement experience we think is unique, and we think that it is not something that there is the ability for your employees to have with some of the carriers that you may be working with today. So not only is this a favorable experience for you as a business, but the experience and the engagement that your employees and their dependents will have, we think is very, very significant. In fact, the service to the members is going to include their member website, mobile app. It will also include telemedicine. In today's fast-paced environment, we don't want people erroneously or inappropriately using urgent care or the emergency room. And the advent of telehealth is becoming much, much more mainstream. That telemedicine feature is included in this program for all of your employees and their dependents, which we think is very, very important. And then finally, there are different networks that are available. We'll talk about the plan designs in a moment that are available with Aetna. They've got networks that are large. They've got networks that are more tiered or narrowed in scope. That gives each company the ability to tailor their own benefit plan that coincides with a specific network. So a little bit further on the value proposition, if you will, going to the health plan design and offerings. This is certainly something of interest when you're thinking about how your benefit plan can stack up against your competition. How will you attract and recruit and retain the best talent? Well, a couple things here that are really, really important. So there are 22 different health plan options that you can choose from as a business. And in fact, if you like 6 of the 22 and want to offer them to your employees, you can do that. In the normal small and middle market, there are significant limitations. around how many coverages you can make available to your employees. Employees don't come in a one-size-fits-all. They've got different issues and needs depending upon where they are in their life, how many dependents they have, and so the ability to have a menu of 22 plans, we believe, is really unprecedented. And they include PPO-style benefit programs, they include consumer-directed plans, but clearly 22 options that you do not have access to today, we think is very, very distinctive. In addition, I mentioned before, there are different networks. And so these networks, when you line them up with the 22 options, will give your business the ability to look at which of the Aetna networks makes most sense for your employees. A larger network may have a higher premium. A more middle-sized network may have a lower premium. This again gives you choice that you simply don't have outside in the normal marketplace. One, because you belong to BioNJ, and two, because BioNJ has made the foresight and strategic decision to join this platform. Pharmacy is equally as important. There are 6 different pharmacy options that you can line up in tandem with the health plan options. Again, a lot of variety, a lot of flexibility so that you can tailor a benefit plan at your group size that in the past would only have been eligible or available to groups that may have many thousands of employees. There are 4 dental options that are administered either by Delta Dental or by Guardian, 2 of the larger national dental providers, and there are a host of member tools, some of which we have talked about, that we believe will enhance the member's experience in navigating through the healthcare system. So the key takeaway here is, because you belong to BioNJ, and because BioNJ has entered this program, your company will be able to offer options and solutions not available anywhere else to this degree of comprehensiveness or this degree of flexibility. Here are some of the partners that are engaged in the administration of this program. We've talked about some of their names, but there is included in the plan's premium the ability to have health risk arrangements, FSA, dependent care, COBRA administration, all of those features which you may now separately be buying or separately arranging for are included in this platform. Express Script is the administrator of the pharmacy program. So the way that Aetna manages the health plan, Express Script is the pharmacy administrator. Express Script is one of the largest such providers in the country with a very robust network that of course includes the major chain pharmacies and so forth that many of you are likely using today. Delta Dental administers 2 of the dental plans. Guardian, it also administers 2 of the plans as well. And another very neat feature that is available to BioNJ companies in this program is something called the Gym Network 360. This will give your employees and their dependents access to discounted memberships at a host of health clubs, access to discounted weight loss programs, and even coaching programs. So these are value-added features that your employees and their dependents will get if you, in fact, decide to place your benefits inside the member's health plan through BioNJ.
Great.
So, Deb, I think I'm turning it back to you.
Thank you. Thank you. Well done. Thank you, Joe. Thank you for it. Appreciate it. If anyone would like to learn more about the plan or get a quote, I would ask that you contact Patrick Dillon from Connor Strong and Buffalo. Patrick's name and picture and phone and et cetera are all on the screen in front of you. If you work with your broker, remember that you can have your broker contact Pat directly, and they will be more than happy to work with your broker. If you're not already a BioNJ member, I would ask you to please contact Kim Minton, whose photo and contact details are on the screen now, and we'll get you signed up as a BioNJ member because that is a requirement in order to participate in the plan. Our health plan is one of many great benefits of membership. I would also mention the fact that New Jersey is a MEWA-friendly state, clearly, and there are just a handful of states that actually honor MEWAs, so we're very, very, fortunate to have that be the case in New Jersey. So now it's time for our Q&A. If you haven't already done so, we'd ask that you please type in your questions on the screen. Okay, and we do have actually a couple of questions. So Joe, it looks like this is one for you. So someone's asking, do we need to change our benefits in order to join this program?
Sure. Thank you, Deb. So as we mentioned, on the health side, there are 22 different benefit options. We believe in all likelihood that most companies won't have to change the level of benefit that they're offering because of the extraordinary number of choices and options that are available. In fact, our suspicion is that when an employer looks at these 22 options, they're going to have a greater capacity to offer benefits that may, in fact, better cater to what their workforce looks like. So we think there'll be a lot of similarity. We also believe that when an employer goes through all of these options, they're going to be able to expand the amount of choice that they actually give their participants.
Okay, great. Thank you, Joe. Bridget, probably a question for you. On what dates can we enter the program?
So it's very similar to the market today, so you can enroll on the first of any month. And again, going back to being a member of Bio, you can receive a quote from your broker to make sure that it makes sense, and then joining Bio after the fact. So we are flexible, but on the first of any month, we are happy to take any employer group.
Okay, great. Thank you. Also, Bridget, probably another question for you. We have employees that live in multiple states. Are there any restrictions around residency?
There's not. The plan does have an eligibility requirement of a participation, what we call participation requirement, but we'll look at that on a group level, right? So again, as you mentioned, Deb, New Jersey is the MEWA-friendly state, so the rules and regs are around New Jersey. So we want to ensure that our members have the least amount of disruption. So primarily, if most of your employees are in New Jersey, it's fine. But we can look at every group on an independent basis.
Case by case.
Yes.
Great. Okay, thank you. So Joe, do we need to lock into this program for multiple years, or is this a year-by-year decision?
Sure. This is a year-by-year decision. So an employer does not have to sign up for multiple years. They will engage, if you will, and become a part of the member's health plan on a yearly basis. And again, employers have an obligation to look at different solutions that are out there from time to time. So there is not any long-term commitment that anyone has to make. As you mentioned earlier, Deb, the key is, in order to enter the program, BioNJ companies, they need to be in BioNJ, which is really, really important. And obviously, this is a feature that BioNJ has made available that we think is really special and distinctive.
We do too. We're pretty excited about it. So sort of two related to that is a question. Do I have to pay any other fees to participate in this plan?
Yeah, there are no other fees. So the only cost is the monthly premium. In the same way that an employer is paying premiums today to whoever their health plan may be, there's not an extra fee to have to join the member health plan. Employers will simply pay the healthcare premiums like they are doing today.
And their BioNJ membership.
And of course,
right.
their BioNJ membership, the
Right.
best investment they can make.
Right, exactly. There you go. So Bridget, does this plan use health status or medical questions to rate the group?
We don't. So this is a plan where the rates are preset based on, again, we're going to go to the economies of scale, the total population. So what we need when we run a quote is your employee, your date of birth, your gender, and your coverage, and we will run a rate quote for you. If you are a larger employer, 50 plus, we can look at your claims experience and look at you a little bit differently. So, you know, again, we are flexible. We can look at this on a case-by-case basis, but for the most part, the small employers, no, we do not ask for health status or medical questions.
Okay. Okay. We have a question. Is there a minimum employer number?
So the minimum number of employees.
Employee, I'm
yep,
sorry. Yeah.
That's okay. So the minimum employees is, the requirement is you need to have at least 2 full-time employees, right? So I know with a lot of the carriers, they will not allow a husband and wife group or a partnership. If you have a husband and wife group or you have other employees, you are eligible for this health plan, and that is what's unique. So we do ask that you have at least 1 other full-time employee if you are the owner of a company.
Okay, great, thank you. If someone is traveling outside of New Jersey, do they have coverage?
Absolutely. So with this plan, with every benefit plan that we offer, there is a national network, right? So regardless if you are traveling, you do have access outside of New Jersey through the Aetna networks. But if you're traveling and require urgent or emergent care, it is covered at the in-network level, regardless of network, okay? So God forbid something happens, even if you're out of the country, it is covered at the in-network level.
Okay. Okay, great. And I think you mentioned this, but if children are away at college, they're covered. Is that correct?
Absolutely.
Okay.
Through the Aetna National Network, correct.
Okay, great. Good. Okay. So at this point, unless another question pops up, we have answered all the questions. So I just would turn to Joe and to Bridget. Any closing comments? Maybe Bridget?
Sure. So one, thank you. I mean, we're really excited about this opportunity with BioNJ and working with Deb and the team here. I have been working on this health plan for over 17 years, so I certainly understand whether groups have reservations or whether it might even seem too good to be true, right? This is a plan that I'm proud to be a part of because it is an alternative. It does give options. And again, it's nice to be working with Bio that is providing an alternative to their membership. I'm working with all of our other sponsors. So happy to be here, happy to work with Connor Strong as plan experts. Really, they have mastered the understanding. It is a complicated kind of philosophy, but happy to have all the partnerships that we have today.
Great. Thank you, Bridget.
Yeah, and the only thing that I would add, Deb, I want to echo some of the things we said earlier, maybe as a wrap up, is that this is a unique program that BioNJ is making available to its members. Most associations have not been as cutting edge and as leading edge to try and tackle healthcare. Your companies are dealing with the rising healthcare costs, their need to remain competitive, and credit to BioNJ out in front, delivering a solution to its member companies that we all believe is going to have a real value added impact. It's not a complicated program. Really, at the end of the day, it's going to work like many of the coverages that you buy today from the private market, except you have your own separate arrangement where the president of your association sits on the board. And that kind of representation does not come often and is frankly almost non-existent in terms of how you might deal with the insurance carriers. We believe it offers the stability that companies are looking for rather than the uncertainty every year that often comes with this benefit experience, and the ability to offer the variety of plans, of options, and solutions that just isn't available to companies that are probably not in BioNJ, and certainly companies that don't have thousands and thousands of people. So we encourage all of you to certainly take advantage, at least at looking into this program and working with our team at Connor Strong and Bucklew. Our job is to help make sure that we educate employers, that we educate your brokers, and that we give you the information you need to make the best decision about evaluating this plan as an option. Pat Dillon is an expert in life sciences. Pat's on my team at Connor Strong. He knows your business. He knows your challenges. And he really will be the point person to work with you and any of your brokers in helping to make sure we've given you the right information to make the most informed decision on this plan. So really kudos to Deb and her team at BioNJ for being out in front of this issue, making this program available. We really believe it'll be a very successful option for many of the BioNJ companies, and we too are delighted to be your partner. So thank you, Deb.
Thank you, Joe. And I, really kudos to our board who is so forward thinking and has allowed us to go down this path. So thank you to Joe and to Bridget and to Patrick and to my awesome BioNJ team. Couldn't do it without you. We're very excited about this. Also, I would add, given that I do have a position on the board, if at any point during this process, whether is a follow-up to this, or if you do decide to talk to Patrick and get a quote, if you have any questions or concerns or things that come up, I would be honored to take those questions or concerns to the board. So thanks to all for joining us today. Recording will be available tomorrow at bionj.org of this webinar. We hope that you consider signing on to the plan, and we hope to see you at a future BioNJ event such as the C-Suite Summit on November 8th. So once again, thanks for joining and have a wonderful day.